Hi, I'm Andrew Drakeley and I'm the Clinical Director at the Hewitt Fertility Centre based at the Liverpool Women's Hospital. For most couples, they'll have come through our workup at the infertility clinic at the Liverpool Women's Hospital, having been referred by their GP. And once the decision has been made to refer you for IVF, we'll complete a form and then bring it up to the Hewitt Fertility Centre. They will then send you out registration forms, which will be posted back, and then following this, you receive information of what to do next, plus the relevant consent forms. You're then booked into for an IVF clinic appointment, where you'll see one of the doctors or the nurse practitioners, where more information will be gathered from you, and then the information about what happens next in terms of the IVF process will be explained. What we also need to do is screen you for HIV, hepatitis B and C within 3 months of having the treatment start. This is an HFEA requirement. Also, all the consent forms need to be completed and checked again before the treatment can start. After that, you will phone with a period, and then there are different ways of doing fertility treatment depending on what problem you have. So for a lot of patients, they'll be sent out drugs, and then those will be taught at a drug appointment with the nursing staff. A start date will be given for either injections or tablets, and this usually induces a second menstrual cycle. At this point, we scan you vaginally, looking at specifically at the womb and ovaries. Then the medication, which is by injection form, which you'll have already received and be taught how to use, is begun. 5 or 6 days later, we'll often scan you again, and when the ovaries have started to respond, we'll add in sometimes different drugs which will stop your body releasing those eggs before we can capture them. On average, the duration of stimulation of injections is about 10 to 12 days. And at this point, we scan you again, looking for the number and the size of follicles on the ovaries. This usually equates to roughly the number of eggs that we might get. Advice will be given about this depending on what your own scan shows. From that, you're given a date and time for the egg collection, and a date and a time for the final injection which you have at home, and that's to mature the eggs. On the day of egg collection, you'll attend the unit early in the morning, and then an anaesthetist will give you sedation, which is injection given through the back of the hand to make you sleepy. It's not classed as a full general anaesthetic, but you're very sleepy and drowsy, and often you'll be in hospital for about 2 hours. For the actual egg collection procedure, the needle is placed through the back of the vagina into the ovary, and the fluid which will contain the eggs is then drained from the ovaries. On that day, you'll leave hospital knowing how many eggs you've got. At the same time, your partner needs to provide us with a sperm sample that will be used to fertilise the eggs. Depending on the quality of the sperm, there are 2 main techniques for fertilising eggs with sperm. IVF stands for in vitro fertilisation, and that's where an egg and a sperm are put together with 100,000 sperm in a dish and left overnight, and then nature will decide which sperm fertilises the egg. If there's a problem with sperm quality, you'll be recommended a procedure called ICSI, which stands for intracytoplasmic sperm injection. And that's where a scientist, called an embryologist, will select a single sperm to inject into the egg to try and make the embryo that way. The following day, you're phoned to tell you how many of the eggs are fertilised. Not all eggs will fertilise. On average, about 60% will do so. Then those embryos are grown in the laboratory for 3 to 5 days, and a day 5 embryo is called a blastocyst. Along that time, the embryologist will be monitoring the growth and development of the embryos, looking for stages of development. Based on that, they'll be recommending the embryo transfer, which will usually take place on the 5th day after the egg collection. For the embryo transfer, we pass the speculum as if you're having a smear test, clean the neck of the womb, feed a fine tube into the womb through the cervix and inject the embryo. That usually takes about 10 minutes to do and doesn't require any anaesthetic. After this, you'll have already been started on vaginal progesterone pessaries that help support the pregnancy in the first 2 weeks. Roughly 12 days after the embryo transfer of a day 5 blastocyst, we'll ask you to do a pregnancy test. Hopefully it will be positive, in which case you're pregnant, and we'll book you for an ultrasound scan 3 weeks later to make sure that the embryos are growing inside you. Unfortunately, sometimes this is not successful, in which case you'll have the opportunity to see the clinical staff in clinic and also counsellors for support should that be required. I think in preparation for becoming parents, a healthy lifestyle is important. This means cutting things out that may well be well documented to be harmful for pregnancy, certainly smoking, drinking excessively, obtaining a good weight and normally body mass index between 20 and 30 is encouraged and is actually mandated by the NHS to be eligible for treatment. The rest of it is just sensible things. Folic acid, 400 micrograms for a woman, and general multivitamins for the man and the woman. Roughly 2 weeks after the embryo transfer, we'll be doing a pregnancy test, and if it's positive, you're pregnant, and if it's negative, then it's not likely that you are. The Hewitt Fertility Centre is one of the largest NHS providers of fertility treatment and IVF in the UK, treating roughly 2,000 patients in Liverpool and 500 a year in Knutsford. So as a combined group, we're one of the biggest. Also, we offer a full gamut of services from IVF, ICSI, egg donation, sperm donation, and so on. And since 2013, surrogacy also. We're also the regional centre that treats patients who've got cancer, who are about to have their fertility harmed by either surgery or chemo or radiotherapy. Similarly, we're one of a few units in the country who can treat patients who have transmissible viruses such as HIV, hepatitis B and C. From a pregnancy rate viewpoint, we have a respectable 50% pregnancy rate for the under 35s. If unfortunately you don't get pregnant on the first attempt, you'll be offered a clinic appointment with a doctor or nurse to discuss what happens next. If we do have frozen embryos in storage, then they will be used first. If a woman has a regular menstrual cycle and knows that they ovulate, we'll do a natural frozen embryo transfer. That means no injections or tablets or needles. If, however, a woman has a more chaotic menstrual cycle or doesn't ovulate, we need to chemically manufacture a menstrual cycle so all the hormones fall in sync for frozen embryo transfer. This does involve tablets and injections. If you have more NHS funding entitlement to you, then we can talk about second or even third cycles. However, if the NHS entitlement has been exhausted, other options such as self-funding the treatment can be discussed. In terms of what they might be, that will depend on your own situation, how many eggs we got, how many embryos we got, what they did, what the sperm quality is like and so on. So each of that needs to be tailored to the individual couple.